Bismillahirrahmanirrahim. The quote of the day is to create exponential growth in healthcare, we need to put tremendous resources and focus behind the best human minds working in this field. Today, the topic of presentation is uh, WHO document on global strategy on human resources for health workforce 2030 under the kind supervision of Professor Dr. Saira Afzal. The learning outlines of today's presentation is the vision, goal, objectives, and milestones of WHO document on global strategy on human resources for health workforce 2030. By the end of this presentation, participants will be able to describe who developed a global strategy on human resources for health, why is having a global strategy on human resources for health necessary, who are health workers, why are health workers important, what is the vision, goal, and objectives of this strategy. In May 2014, 67th World Health Assembly took place for the resolution of follow-up of the received political declaration on the human resources for health, renewed commitments towards universal health coverage. In paragraph 4 by 2 of that resolution, member states requested the Director General of WHO to develop and submit a new global strategy for human resources for health for consideration by the 69th World Health Assembly. The final version of the global strategy on human resources for health was considered by the WHO member states at 69th World Health Assembly in May 2016. Now, why is having a global strategy on human resources for health necessary? We have better evidence than ever before on what works and what does not in health workforce development across different aspects, ranging from planning, education, management, retention, and incentives, linkages with the social service workforce, and a global strategy that addresses in an integrated way all these aspects can inspire and inform more incisive multi-sectoral action based on new evidence and best practices at national level by planners and policymakers and at global level by international community. Now why do we need it now? The international community is working to identify a new set of global developmental goals for the period 2016 to 2030 that are the Sustainable Development Goals. The health workforce is one of the areas under consideration as part of the proposed health objective. The development of a global strategy on human resources for health now is therefore very timely because in its early stages, the process to develop the global strategy on human resources for health can also influence the decisions on post-2015 development agenda. And once these broader goals and targets have been set at a political level, the global strategy on human resources for health can provide concrete recommendations and ideas on how to achieve them at a more technical level. Now, who are the health workers? According to WHO, all those people engaged in actions whose primary intent is to enhance health are the health workers. These include physicians, nurses, midwives, laboratory technicians, public health professionals, community health workers, pharmacists, and all other support workers whose main function relates to delivering preventive, promotive, or curative health services. Now, why are health workers important? Health workers are the core of the health system. Without health workers, there is no health care. National and global efforts to achieve the health targets of the Millennium Development Goals set by the United Nations in 2000 are thwarted in many countries by shortages of health staff. There are often inequitable distribution and gaps in their capacity, motivation, and performance. Similarly, the ambitious targets under consideration by the United Nations as part of the Sustainable Development Goals that will replace the Millennium Development Goals will only be achieved if dramatic improvements are made to strengthen the health workforce. No, isn't this a problem just for the poorest countries? Low and middle income countries face the most severe challenges in ensuring a sufficient, fit for purpose, and fit to practice health workforce. A recent analysis conducted by the Global Health Workforce Alliance and WHO estimated a gap of 7.2 million professional health workers in 2012 that will rise to 12.9 million over the next decade. Countries at all levels of socio-economic development face the challenges of how to sustain the human capital required to guarantee universal access and universal health coverage. Now, with so many competing development priorities, are health workers worth the investment required? Investment in health workforce is one of the best buys in public health. For example, investing in midwifery education with deployment to community-based services can yield a 16-fold return on investment in terms of life saved and cost of cesarean sections avoided. In addition, evidence is starting to emerge on broader socioeconomic impact of investments in health workforce in terms of improving synergies with education, creating career opportunities for women, facilitating decent employment in the formal sector, and fueling economic growth. Now, the vision of the global strategy. The vision is to accelerate the progress towards universal health coverage and United Nations Sustainable Development Goals by ensuring equitable access to health workers within the strengthened health system. Now, the goal. The goal is to improve the health, social, and economic development outcomes by ensuring universal availability, accessibility, acceptability, coverage, and quality of the health workforce through the adequate investment to strengthen health systems and the implementation of effective policies at national, regional, and global levels. Now, the principles of this strategy. The principles are to promote the right to enjoyment of the highest attainable standard of health, provide integrated people-centered health services devoid of stigma and discrimination, foster empowered and engaged communities, uphold the personal, employment, and professional rights of all health workers, including safe and decent working environments, and freedom from all kinds of discrimination, boycott, and violence. To eliminate gender-based violence, discrimination, and harassment, promote international collaboration and solidarity in alignment with national priorities, ensure ethical recruitment practices in conformity with provisions of WHO Global Code of Practice on international recruitment of health personnel, mobilize and sustain political and financial commitment, and foster inclusiveness and collaboration across sectors and constituencies. And the last principle is to promote innovation and use of evidence. Now, in this strategy, four objectives are laid down. The first objective is to optimize performance, quality, and impact of health workforce through evidence-informed policies on human resources for health, contributing to healthy lives and well-being, effective universal health coverage, resilience, and strengthened health systems at all levels. For this objective, three milestones has been given. First is to by 2020, all countries will have established accreditation mechanisms of health training institutes. Second milestone is to be achieved by 2030, and according to this milestone, all countries will have made progress towards having inequalities in access to a health worker. And third milestone is by 2030, all countries will have made progress towards improving the course completion rates in medical, nursing, and allied health professional training institutions. Second objective is align investment in human resources for health with the current and future needs of the population and health systems. Taking account of labor market dynamics and education policies to address shortages and improve distribution of health workers so as to enable maximum improvements in health outcomes, social welfare, employment creation, and economic growth. For this objective, four milestones have been set. First is to by 2030, all countries will make progress towards having their dependencies on foreign trade health professionals, implementing the WHO Global Code of Practice on the international recruitment of health personnel. Second milestone is by 2030, all bilateral and multilateral agencies will have increased synergies in official development, a system for education, employment, gender and health, in support of nation health, employment, and economic growth priorities. Third is, by 2030, partners in Sustainable Development Goals will have made progress to reduce the barriers in access to health services by working to create, fill, and sustain at last 10 million additional full-time jobs in health and social care sectors to address the needs of United Nations underserved populations. Third objective is build the capacity of institutions at subnational, national, regional, and global levels for effective public policy stewardship, leadership, and awareness of actions on human resources for health. Three milestones had been set to achieve this objective. First is by 2020, all countries will have inclusive institutional mechanisms in place to coordinate an intersectoral health workforce agenda. Second is by 2020, all countries will have the human resources for health unit with responsibility to develop and monitor policies and plans. Last is by 2020, all countries will have regulatory mechanisms to promote patient safety and adequate oversight of the private sector. Last objective is strengthen data on human resources for health for monitoring and accountability of national and regional strategies and global strategies. Three milestones has been set. First is by 2020, all countries will have made progress to establish registries to the health track, workforce stock, education, distribution flows, demand capacity, and remuneration. By 2020, all countries will have made progress on sharing human resource for health data through national health workforce accounts and submitting core indicators of the WHO Secretariat annually. By 2020, all bilateral and multilateral agencies will have strengthened health workforce assessment and information exchange. No, in this strategy, three annexes has also been presented. First annex health workforce requirements for implementation of global strategy on human resources for health. In this annex, uh, the existing total health workforce in 2013 has been given, and the forecast of the total healthcare workers in 2030 has also been estimated. And according to this, the total health workers in 2013 are 43.5 million, and according to the current trends, the forecast of total health workers in 2030 will be 67.3 million. All health workers includes all the physicians, nurses, midwives, and all other categories that include pharmacists, lab technicians, public health workers, and community health workers. Now, an updated need-based sustainable development goal index of minimum density of doctors, nurses, and midwives. According to the 2006 World Health Report, it has been stated that 80% coverage of assisted deliveries has been achieved by the threshold of 2.3 skilled health workers per thousand population. In considering a new health workforce threshold, the focus must shift to reflect the broader range of services that are targeted by the Universal Health Coverage and Sustainable Development Goal. Coverage data for all countries available for the 12 indicators were combined in an aggregate coverage indicator that is called the Sustainable Development Goal Index, which weighted the importance of specific indicators based on the contribution of the diseases they track to the global burden of disease. This is the Sustainable Development Goal Index and also the classification of the indicators. The indicators included in this are 3 for the mother and newborn child health, 4 are for the non-communicable diseases, and 5 are set for the infection diseases. For mother and newborn child health, the indicators include the antenatal care, family planning, and skilled birth attendant. Now, Sustainable Development Goal Index composite method, percentage of 12 Sustainable Development Goal tracer indicators achieved as a function of aggregate density of doctors, nurses, and midwives per thousand population. On the basis of analysis conducted, an indicative threshold of an aggregate density of 4.45 physicians, nurses, and midwives per thousand population was identified as it corresponds to the median score of Sustainable Development Goal tracer indicator attainment, that is 25%. This value has been used for the needs-based estimates in the analysis in this study. Now, the estimates of healthcare needs-based shortages in countries below the Sustainable Development Goal Index threshold by the region in 2013 and projected forecast in 2030. According to this, in 2013, the shortage of the health workforce is 17.4 million, and it will be 14.5 million in 2030. And the current trends of health worker production and employment will not have sufficient impact on reducing the need-based shortages of healthcare workers by 2030. So the estimated health worker demand in 165 countries by region. This include in 2030, the total health workers requirement in Africa are 2.4 million, and in America it is 15.3 million, and in Eastern Mediterranean region it includes 6.2 million, and in Southeast Asia region it requires 12.2 million, and in Western Pacific region it requires 25.9 million health professionals. So the second annex that is given in this strategy is an annotated list of selected WHO tools and guidelines for human resources for health. And in this context, it is given that transforming and scaling up health professionals, education and training task is shifting for HIV and optimizing health workers' roles for maternal and newborn child health, increasing access to health workers in remote and rural areas through improved retention, monitoring and evaluation of human resources for health with special application for low and middle income countries, analyzing disrupted health sectors. Third annex is monitoring and accountability framework. The monitoring and accountability framework of the global strategy entails a regular process to assess progress on its milestones. Global accountability will include a progressive agenda to implement national health workforce accounts with annual reporting by countries on core human resources for health indicators to the WHO Secretariat. The monitoring and accountability framework to assess progress on the global strategy milestone. For each milestone, uh, these indicators has been given to assess the monitoring and accountability framework. Like for the milestone, uh, all countries having inclusive institution mechanism in place to coordinate intersectoral health workforce agenda. The monitoring and evaluation can be done by setting a baseline indicator in 2016 as the percentage of countries with institution mechanism in place to coordinate an intersectoral health workforce agenda. In for to assessing this, the numerator that has been set is the number of countries with an human resources for health unit or function that negotiate intersectoral relationships with other uh, the ministries and stakeholders, and the denominator set is total number of countries, and periodicity of data collection is annual. These are all the also the examples of assessing the monitoring and evaluation of the milestones. Now, the core WHO Secretariat activities in support of implementation of the global strategy. To develop normative guidance, facilitate the sharing of best practices, provide technical cooperation on health workforce education, optimizing the scope of practice of different categories that include gender mainstreaming, streaming, availability, accessibility, acceptability, coverage, quality control, and strengthening of the public regulation. Provide technical cooperation and capacity building to develop core competency in policy planning and management of human resources for health focused on health system needs. Foster effective coordination, alignment, and accountability of the global agenda on human resources for health by facilitating our network of international stakeholders. Review the utility of and support the development, strengthening, and update of tools, guidelines, and databases relating to data and evidence on human resources for health for routine and emergency settings. Facilitate yearly reporting by countries to the WHO Secretariat on a minimum set of core indicators of human resources. To provide normative guidance and technical cooperation to facilitate the sharing of best practices on health workforce planning and projections and health system needs, education policies, health labor market analysis, and costing of national strategies on human resources for health. Now, these are the recent updates. The title of the article is Analysis of Human Resources for Oral Health Globally and Inequitable Distribution. The aim of this paper was to provide a contemporary analysis of human resources for oral health by examining the size and distribution of dental workforce according to WHO region and in the most populous countries. The results of this study is the majority of the world's 1.6 million dentists are based in Europe and America, cited as 69% of the world that is serves 27% of the global population. Africa has only 1% of the global workforce, and that there are marked inequalities in access to dental personnel, as demonstrated by the population to dental workforce ratios. Gaps exist in the dental workforce data, the most notably relating to the mid-level clinical providers such as dental hygienists and therapists, and human resources for oral health data are not regularly updated. The conclusion is marked inequalities in the distribution of global human resources for oral health exist both in regions and countries, with inequalities most apparent in areas of high population growth. Detailed contemporary data on all groups of human resources for oral health are required to inform global workforce reform in support of addressing population of oral health needs. Second article is Iran towards universal health coverage, the role of human resources for health. Given the key role of educated, skilled, well-trained, and motivated human resources for health in achieving universal health coverage, This manuscript aimed to investigate the current situation of Iran for human resources for health after the implementation of recent health transformation plan in accordance with universal health coverage analytical framework using four domains of availability, accessibility, acceptability, and quality. Conflicts of interest and multiple interventions from different sectors have controversial and sometimes negative effects on the health performance. Thus, to achieve the objectives of universal health coverage from perspective of human resources, Iran needs unified governance and comprehensive planning. Also, the effects of health system interventions on health workers should be assessed, assessed by assessed before implementation. Now the time for MCQs. First MCQ is to achieve a certain target, a minimum number of human workforce is required. According to 2006 World Health Report, home minimum skilled health workers per thousand population required to achieve 80% coverage of assisted deliveries. Options are 1.3, 2.3, 3.4, and 4.45.
B.
The correct option is 2.3 health workers per thousand population to achieve 80% coverage of assisted health delivery. Second MCQ is health system can only function with health workers and by improving their health service coverage by merely the availability or their quantity or availability or the quality or their quality only or the availability, accessibility, acceptability and quality.
D.
D.
Yes, D is the correct option. Third MCQ is all people engage in actions whose primary intent is to enhance health and all other support workers whose main function relate to delivering preventive, promotive or curative health services are the health workers. From the list given below, which are not the health workers, whether the laboratory technicians, public health professionals, not-profit organization workers, community health workers or the pharmacists, which are not included
C.
in the, yes,
C.
C is the correct option. The planning, design, and implementation of the policy options can be informed and supported by a number of tools and guidelines. Which of the following is not considered as a selected product developed by WHO on human resources for health? Well, scaling up health professional education and training, increasing access to health workers in remote and rural areas, monitoring and evaluation of human resources for health, or ignoring the disrupted health sectors.
D.
D.
Yes, D is the correct option. Fifth MCQ is considering the cost benefit analysis. What do you think that investment in which health area is one of the best buys in public health as it is the core of the health system, whether the health workforce, health infrastructure, health related equipment, or the health related diagnostic laboratories?
B.
A health workforce is the best buy in health. Sixth MCQ is the monitoring and accountability framework of the global strategy entails a regular process to assess progress on its milestones. Which of the following milestones is not necessary to be achieved for the leadership and governance of actions on human resources for health? Whether institutional mechanism in place to coordinate an intersectoral health workforce agenda or have an human resources for health with unit with responsibility to develop and monitor policies and plans or have regulatory mechanisms to promote patient safety or made progress to establish registry to track health workforce stock.
A.
D is the correct option as this is not including in the leadership and governance of actions of human resources for health. Seventh MCQ is health workers are the core of the health system and without health workers there is no health care. Which of the following best described that the investment in a health workforce is one of the best buys in public health? Whether investing in midwifery education can yield a 16-fold return on investment in terms of life saves, or establishing a hospital will benefit the whole town, or the installing of modern equipment will give the best results, or the road traffic signals can prevent deaths due to road traffic accidents.
A.
A. A.
Yes, A is the correct option. Eighth MCQ is health system can only function with health workers. Improving health service coverage and realizing the right to the enjoyment of the highest attainable standard of health is not dependent on their availability, accessibility, acceptability, or assessment.
D.
D.
Yes, D is the correct option. Ninth MCQ is which of the health area has a vital role in building the resilience of communities and health system to respond to disasters, whether the health workforce, health infrastructure, health related equipment, or health related diagnostic laboratory.
A.
B.
Yes, A is the correct option. Last MCQ is according to WHO, at which threshold level of an aggregate density of physicians, nurses, and midwives per thousand population was identified that will correspond to the median score of 25% of the Sustainable Development Goal tracer indicator attainment, whether 2.35, 3.36, 4.45, and 5.59.
A.
B.
B.
3.36.
4.45 physician, nursing, and midwives per thousand population was identified. So C is the correct option. This is the key of my MCQs, and thank you very much.
Dr. Awais, it was a very nice presentation. You can end it.
Okay,
Thank
Dr.
you.
Sadia, thank you.
Allah Hafiz.